And you know, the new year is a time many of us think about improving our health. Mark Thompson is here this morning with more on the challenges that many in the African American community face when it comes to living that healthy lifestyle. Good morning to you, Mark.
Yeah, good morning to you, Allison. And being healthy, it really can be a struggle for everyone. But African Americans face a unique set of challenges stemming from a history of often being on the outside looking in when it comes to the healthcare system. High blood pressure, diabetes, obesity, just a few health issues among dozens that plague the African American community. Local cardiologist Dr. Paul Underwood says a lot of what ails is due to poor diet.
If you're not able to have adequate nutrition or preventive nutrition, then it puts you at risk for developing some of these conditions.
The poor eating habits, he says, can be traced all the way back to slavery, where black slaves were forced to eat what their masters tossed aside, like the discarded parts of a pig or chicken.
We had very limited resources at that time, and those foods were necessary for survival.
Some slaves were allowed to grow vegetables in small gardens, but most resorted to adding salt and fat to meals to stretch and make them taste better. The early origins, many say, of what's now called soul food and a major part of black culture.
Those foods we see now are not as healthy.
And if you did get sick, options back then were limited. Underwood says in most cases there was only one black doctor in the community, and they were forced to treat patients in facilities with few resources. In fact, he says, it wasn't until the first big pandemic, the Spanish flu of 1919, that black doctors finally gained access.
They actually started allowing black physicians to go to the white hospitals to treat the white patients, definitely. But they still did not allow the black patients to go to the white hospitals.
Discriminations of the past leading to a mistrust in the healthcare system that many African Americans still have to this day.
And I was misdiagnosed for years.
Burdetta Hodge has thalassemia minor, a rare blood condition that's led to heart failure and other health conditions. For years, she says doctors couldn't figure out what was wrong, and she believes it's because they didn't want to consider her race as a factor.
We're commonly misdiagnosed for things because the way our body is affected by it is not the same. And if you're not looking for it in an African-American woman or African-American male, you miss it.
And finding a black doctor, she says, was critical in her journey back to good health.
And it took Dr. Underwood to determine that and to find out that we have to treat each person separately, and you have to look at race when it comes to health.
Burdetta's son, Jevin Hodge, has been by his mother's side every step of the way, seeing firsthand the disconnect between African Americans and the healthcare system. Priority number one, he says, is more trained professionals to help patients with things like taking notes and keeping up with insurance while they're sick.
And they need people to help them. Not everyone is in a situation where they have family to support them or a colleague to support them or, a significant other. We need more patient navigators within our healthcare system.
And finally, self-accountability. They say do the research and seek programs. Take pride in eating healthy and getting proper exercise so you don't become a patient in the first place.
In fact, it's better to go to your doctor, take preventive measures so that you don't become sick. But that attitude hasn't really permeated into the black community to a significant degree.
We don't have a healthcare system. We have a sick care system in this country. We have a system where you go to get care when you're sick, not to keep up with your health.
And another big disparity when it comes to African Americans is mental health. In fact, according to the CDC in a study completed by Cigna, African Americans are only 20% as likely to report a case of mental health, but 50% less likely to go out and seek treatment. So still some ways to go. Reporting live this morning, Mark Thompson, ABC 15, Arizona.